Hello, I'm Antonia Yankova from Europa Dona Bulgaria Foundation, and I would like to welcome Dr. Sanjivani Taruna, who is visiting Bulgaria today. This year again, she is surgeon, founder, and director of Sahasi Breast Care Institute in Davalpur, India. Welcome to Bulgaria again, and thank you for accepting being here with us for this interview. Dr. Taruna, could you tell us a few words about yourself and your project, Sahasi Breast Care, please?
As you said, my name is Taruna. Also, I'm named Sanjivani. So I studied from the medical college, one of the biggest medical college that time in Asia, Nagpur Medical College. I did my graduation and post-graduation from this medical college. And I worked as a surgeon for almost 13 years after my post-graduation. And then I started changing my lifestyle because I was very stressed and I had multiple surgeries on my body. So I had to change something. So then I went to the traditional ways, and yoga I was doing already from the age of 12. And so I was asked to take out my adhesions, so another surgery which I didn't want at all. So I said there has to be some other ways to deal with this now after 4 or 5 surgeries. So then I really went for yoga and Ayurveda, and without adhesions. I can sit like this now. Before I had to always sit like this. So that made me really very much interested to see this other side, how it works. And both combination is the most beautiful way to work. So I'm also using my medical knowledge as well as traditional knowledge and created the Sahasi breast care work.
What are the main benefits from the women's healthcare system that you created? What makes it different? As you already said.
Okay. It is like unique. I would say this is a unique work. Nothing like this is existed because there are yogasanas, there are meditations, there is a diet, everything is available. But the sequence and the way it should be used to bring zero stress in a system, because all the diseases come because of the stress. It can be physical, mental, emotional. But when we bring our system on a zero stress level, we are naturally disease free. And with this Sahasi breast care work, we can really bring our whole system on the zero stress level. So this is unique because it can be work as a prehabilitation. For example, the breast cancer, when it's diagnosed, it's a big shock to whole system. So the woman, before going for the treatment, really needs a prehabilitation. So she is prepared to go through all these stages. And after that, she also needs good rehabilitation. And a good rehabilitation, unfortunately, for the breast cancer woman is not available except Sahasi breast care work.
And according to your observations, what distinguishes Bulgarian women and patients from those in India, as well as in other countries you work with, in Europe, for example, Germany?
Like in Bulgaria, I come many years now. This is 22nd year I'm coming.
Yes.
So it's almost like my second home now. And I feel the difference in Bulgarian women is they have a beautiful combination of East and West. They are neither too Western, they are not neither too Eastern. Like in India, there is lot of conditioning about the breast. If something happens here, the woman doesn't want to speak about it because of the taboo, because what people will say till she goes to the final stage. And that's why the mortality rate in India is very high compared to. But the Bulgarian woman is equal, like she takes the step, she's able to go through the stages, and it's nice to work with them because they are very receptive.
Yes. And what would be the recommendations that you give to women for prevention? You already told us especially for the breast cancer. Prevention is trying to combine the two.
Yes, the
Yes.
prevention, we say that prevention.
For younger women, because now the limit of age is going
Yes.
slower, down and down.
Yeah.
More and more young ladies are getting
Yeah.
breast cancer,
This is
unfortunately.
very unfortunate.
Hmm.
It's not that all the breast cancers can be prevented, I must say, but it can be avoided. And the almost 30 to 40% can be avoided by changing little bit of the lifestyle. Like having physical activity is very important. To maintain the weight is very important. To have a good organic food is very important. Not to smoke, not to drink is important. So all these things can decrease the risks. And also, if by chance, if I would get a breast cancer, my survival rate is much more higher because what I have done for myself in this time.
Yes. And this would be the way that you would encourage patients that receive the diagnosis for the first time and the plan for the treatment. For example, I was diagnosed, and imagine that I hear this for the first time. What would be the words that you will tell me at the beginning to encourage me, to make me sure on myself that I could go through this?
Yes,
with success?
the prehabilitation, this is where the prehabilitation comes. Women are naturally very deeply connected with their breasts. And if something happens here, most of the time, fortunately, all the lumps are not breast cancer. So if we find something in our breast, we should not really start thinking, oh, I have a breast cancer, because 80 to 90% cases are benign cancer, benign lumps, not cancer. So when when we find a lump, first thing is to go to the doctor and make a diagnosis. And when we hear now, fortunately, as the disease has progressed, unfortunately, but the treatments are also very well. So early diagnosis is very important. So first thing, if we find something different in our breast, we should go to the doctor, make a diagnosis. If by chance it comes like a breast cancer, then to stay calm and decide that I will go through the treatment, because many women decide I don't want. I will do only alternative. But this is not the time. Alternative treatment can support a lot, but one has to go through this treatment. And to prepare oneself by maintaining the physical activities, by having a very good diet, by doing some simple meditation techniques, she can calm down her system. And the more healthier we are physically and mentally, the more beautifully we can go through this treatment. This treatment, as you know, is not easy. But as I see you, I know you since many years, and you are one of the courageous women. Sahasi means courage. And every woman needs a courage, first to acknowledge, to work on her breast, and if something happens, to stand to her strength and go through that.
Yes, that's right. Why, in your opinion, it's still very difficult to find doctors who would be able to combine, especially medical oncologists, who would be able to combine the alternative methods in synergy, not harming each other? Because here, for example, in Bulgaria, I'm searching for this kind of doctors, and if I'm talking with them and asking them to receive some some alternative methods for treatment, they're laughing, they're not accepting, then they're telling me, no, you will be harming your treatment, so don't use any. I was taking some of the fetal treatments by myself and with other doctors, not telling the medical oncologist, but the decision can't be taken from the patient. It's important to have this kind of doctors that will combine both of the methods. Why it's still so difficult to find this kind of doctors?
I would say that if I studied allopathy for, let's say, almost 13, 14 years of my life. So I focused in this. So I don't know the other modalities. I don't know how homeopathy is working, how allopathy is, how Ayurveda is working. I have no clue. So I cannot say that, okay, do that. No, because my understanding is narrowed down to one particular line of treatment. What is needed that to understand this? That I, allopathy has its limitations, Ayurveda has its limitations, homeopathy has its limitations, all the treatments. So the doctor or the concerned person should understand his or her own limitations of the treatment. Like, for example, if I have a acute appendicitis, I need to do the surgery. I cannot go to homeopathy and say that treat me.
Yeah.
So the intelligent person is one. Like as a doctor, I would say, like when I worked, the kids had tonsils, and I knew that homeopathy works very well for that. When I was pregnant, I knew I cannot take this allopathy, and homeopathy or Ayurveda healed me without harming my baby.
Yes.
So, with our intelligence, and the doctor should say that this is my limitation, I don't have that much understanding. But whatever heals the person, that is important. Which treatment we are taking is not so important. What makes us back in good health, that is important. And with our intelligence, we should feel and take that treatment. So even if somebody is not saying, because they don't know,
Yes.
so how can they say? But instead of saying, I say, I don't know.
It's better.
You can find it out for yourself what was good for you. Because the aim is the health, not which healing modalities we are using.
And as you say, the intelligent people can feel for themselves which is the best way.
Yes. Yeah.
Yes. And in today's 21st century, in this theme, more and more people are getting cancer. And in the same time, the technology is advancing. The clinical trials are getting, are producing more and more treatments, providing. But the statistics are still very bad. And where do you think globally the world is getting wrong?
I would say that we have gone so far away that we have lost connection with how to live naturally. There are laws of nature. The trees, the animals, the birds, everyone follows it. We eat when we are not hungry. We eat what is not needed. We sleep when we are supposed to wake up. We are dancing in the middle of the night when we are supposed to sleep. All these small, small things which we are not following the laws of nature. We can still be modern, we can still enjoy whatever these modern luxuries are offering us, but at the same time, also to see that my system needs to follow certain laws of nature. And whenever we go against the laws of nature, we become sick. And so, no matter how much the technology is going at a very fast speed, still it is possible to have this combination to follow
Follow the
certain
rhythm
laws
of
of
the
nature
Yes.
and also to enjoy the technology.
That's right. And about the education, the health education in classes, do you think it's necessary to include this in curricula? How would you and your foundation participate in such purpose? I think that you're already making it.
Yes,
You have told
we are
me
making it.
in India, yes.
Actually, there is nothing like breast care education, which is very unfortunate. We have sex education, we have different educations, we have physical education. But what we do, if the daughter is growing up, I would tell her, take this size of bra and wear and finish. But I don't talk about her. What is the importance of the breast? What is the anatomy of the breast? What is the function of the breast? So that this unnecessary ideas which are put from the media, the Hollywood, Bollywood stars coming with this big breast, and the teenage girls think that this is ideal, this is the
Yes.
beauty, which is not
The
true.
model, yeah.
All sizes and shapes of breast are naturally should be acceptable, because it doesn't depend on me how my breast should be. And unnecessary surgery should be avoided. How to take care of one's whole body and the breast is very important. When I was in the medical school, then there was the breast cancer was not such a high level. Now it's a number one cancer, the second commonest cancer to kill. Yes. So over the period of 30 years, lot of changes has happened. And so now it is very important that the girl from the growing age, from the age of 13, should start knowing her breast tissue well, should start working on herself, because the research proves that from the age of 13 to age of 20, if a girl works on her system, on her body, physical, mental, emotional, and on her breast, she has less chances of getting diseases as well as breast cancer. Even after the age of 20, she changes little bit and doesn't work so much, but these are the forming years. So it's very, very important that this education should be implemented in each and every school. My team is willing to go, but we are very small. We don't have funds. We are most of the time, my students, my friends, they are paying from their pocket. Whatever I can do, I do it, but we are very small. If someone is watching this video, this interview, and is really rich and wants to do something beautiful for this earth, and especially for the woman, should support us. We are willing to go to each part of the world and to give the education.
Very nice, yes. I hope so, that it could happen in more and more places and countries and schools. Can you please explain to our viewers what is karma yoga meaning, and what are the actions that
This
we are?
is a
It's very wide
kind of
subject.
big topic,
Yes, big
and
topic.
I don't think I am on that level to talk about it. Uh, my master, my Guruji for yoga from Bihar School of Yoga, Munger, Swami Satyananda Saraswati, he has written and he has talked very beautiful about karma yoga. Yeah, like karma means action. So when we do some action, so what action a human being should do? The action which gives joy to the system and happiness around. That is, in short, very short, karma yoga. So whatever we do in our life with full participation in joyful way, whenever we do some work, karma means work. Whenever we do some work which brings us down, depressed, anxious, disease, that is not the way. Whenever we do certain work which brings lot of joy in our system and joy all around us, that is the real work, the selfless work. Normally we want to take, but when we want to give, that naturally gives joy to the human being. Sharing is a natural, joyful way. And when we can do that, that is karma yoga.
Okay, thank you. And lastly, I would like to ask you if you can give us some basic tips for our Bulgarian friends who might not be able to come to your institute soon, but still would like to start self-care from now. What would
Yes,
you
this
recommend?
is my karma yoga, which is what I do normally, and I would
Yes,
really like to
yes.
say that there are very simple things. Sometimes we feel that, oh, I don't have so much time to do yoga or meditation, and then we don't do nothing. But it is not a big thing. First of all, we can do karma yoga. Whatever we do, I can sweep joyfully, I can clean the toilet joyfully. This naturally brings joy, and this joy brings healing on physical and mental level. This is scientifically studied. Whenever a person is joyful, his healing starts happening. Yeah? So no matter what we do in our life, we try to bring, first we try to practice and bring, and naturally it starts happening then. Then we can do humming, like I'm cooking, I still have to work, then we can do humming. When we are happy, we are humming. And when we are humming, we also naturally become happy. So if I am not so happy, I can start humming and be happy. Yeah, so while walking, whenever possible, sitting is the best way, but also while walking, while cooking, while doing normal things, what we do, we can just close our eyes or even keep them open if we are doing some work and hum. Taking the humming inwards. This is one of the very simplest, easiest way to de-stress our body. Then we can also do any activity, any physical activity. It is proven that it reduces, it is a prevention for breast cancer because it takes out the bad estrogen from our system. So for a woman, it's not a luxury to make her body shapeful or something like that. It is essential to do the physical activity. So walking, swimming, whatever you like, and otherwise, some simple yogasanas, all the young girls should also do this. This is called a very simple rotation of the shoulders. Just doing it slowly. What is very important is to be present, total, and sincere while doing this. That is the most effective. Any simple asana, when it is done with awareness, it brings a lot of benefits. So, clockwise and anti clockwise, we can do this. It's one of the very simple asana and very, very helpful for our chest, breast, shoulder, neck area. Then we can also do some simple massage, which should be done regularly. So if I don't have time, I can put some nice organic sesame oil in my bathroom. Normally, we spend a lot of time, women, for the makeup. If we don't do makeup, we don't end up with any disease. Yeah? But if we don't take care of ourselves in a beautiful way, we might end up with diseases. So we put body lotion instead of that. Sesame oil is very, very helpful for the breast tissue. Taking oil on the palms, putting here, and sending all the love, giving a nice massage strokes like this. Just rotating like this. It's very simple. It's nothing special there. And here we store a lot of toxins. 75% of the breast is draining in this area. Giving nice strokes here. Yeah? Hardly takes like 2-3 minutes.
Only a couple
But
of
we
minutes,
can
yes.
really improve the lymphatic drainage, improve the blood circulation, the toxins are going out, and we feel good for the whole day. So
Yes.
these are some simple techniques. Also in the end, when we lie down in the night, to put our palms on our breast and send all beautiful thoughts and feelings, because these are our also positive energy poles. This is where creativity happens for the woman. This is where the compassion comes for the whole world. So just it's like we call it Anandamai Stanyo. That means blissful bliss meditation. So just sleeping in this. So these are the simple things: humming, rotation of the shoulders, some breast strokes, and in the night, meditation.
Great. Thank you so much. Thank you so much for your time and for accepting to do this interview for Europa Donor Foundation. And I will also special thanks to our cameraman Andrei Kirkov and Momchil Yovkov, Milena Gospodinova and Miglena Micheva from Foundation Europa Donor. We will be happy to welcome you again in Bulgaria next time, and hopefully that we'll have more and more to talk about your project and all the activities that we will do.
Thank
Namaste.
you. Thank you very
Thank
much.
you.
And I hope it reaches the message to the woman, because this is really a time where woman has to start taking care of her breast. Is more than time. This is the time when we, now the youngest, if they start working on their breast, start taking care of the breast, I have a hope that in 100, 200 years, we will have a good evolution and our genes change and we again become healthy self as we used to be. This is my vision and hope. Thank you very much.
Thank you very much.